Welcome those who are online with us today for this lecture. Thank you for your participation in the second part of Symposium 21, Creating a Safe Environment of Mental Health Services. In this lecture, I'm going to briefly review how Taiwanese society responded to the violent behaviors that are inflicted by those who are mentally ill in recent years. To briefly introduce myself, I'm Dr. Tsung-Yang Wang. Currently, I'm working as a consultant psychiatrist in National Taiwan University Hospital in Taipei, Taiwan, which is a vibrant and modern city just like Seoul. I finished my medical training and psychiatry training in Taiwan and got my master's degree in forensic mental health at King's College London. Here, I declare no conflict of interest in the following content. To describe how Taiwan reacted to similar events that have happened to Professor Lim and to help the audience here today to better understand a foreign country's policy, I'm going to review this topic in three aspects, which would be the criminal policy for the offenders, the mandatory treatments which are close to the civil treatment in Taiwan, and lastly, how the legislation targeted on protecting the medical community changed, and share with you some of my thoughts on these measures taken. Let's first take a look at the mentally ill offenders. This is a letter from Taiwan's President Tsai Ing-wen to the widow of a dentist last year. In 2017, while working at his own clinic, Dr. Lai was murdered and stabbed to death by a schizophrenic patient. The patient was believed to come to the clinic to hurt his own sister, who was one of the staff in the clinic, under some persecutory delusion. However, he did not find his sister, but stabbed the doctor along with two other dental assistants instead and caused this tragedy. The patient was given a life sentence rather than a death penalty on grounds of mental illness. The widow protested the decision to the president, and the president vowed to strengthen Taiwan's psychiatric care services in her writings. So after the government reviewed how people suffering from schizophrenia was managed in Taiwan, two measures were proposed as a response to this incident. One is the establishment of a forensic mental hospital. This proposal was discussed in the past 2 years a lot until the COVID-19 pandemic, which put everything onto a pause. To date, there is still no set place or time when will this happen. And the other proposal is indefinite detentions for psychiatry patients who pose a threat to the community. This proposal is now under review by the legislative authority this year. These two proposals involved more deprivation of liberty for those mentally ill patients and were contrary to human rights thinking in the modern society. But how did Taiwan come to this situation? In Taiwan's criminal code, an offender of crime might not be punished, or his sentence could be reduced if his action proved to be linked to his own mental illness on grounds of the insanity defense. The court would consider his ability to judge and his ability to act according to his judgment under the doctor's review and all the evidence. This two-level framework of insanity defense derived from Germany and was amended in 2006. However, even after almost 2 decades of the practice of this law, every time a murder inflicted by a mentally ill patient was covered on the news, it is a general conception for Taiwan people to think that mental illness is just another way of avoiding their responsibilities. Furthermore, this two-level framework was not easily interpreted as the court at the court, as the judge and lawyers relied a lot on the doctor's profession for the biological explanation. Also, around the same time when this insanity defense was put into use in Taiwan, the custodial protection for these people who got their sentence reduced was limited to a 5-year period at most. These people might be put in some psychiatry ward after they were convicted or served some time in prison. However, there are still some problems even to this day after the amendment in 2006. The first is that the insanity defense was not generally acceptable to the people in Taiwan. Culturally, Taiwan is still a country with the death penalty, and people still believe in the payback or eye for an eye sense of value. When someone was murdered by another person, even if that person suffered from severe mental illness, it is still hard to convince most Taiwanese people not to punish this murderer, not to mention trying to treat him. The second problem is that it's hard to find a suitable place or psychiatry ward to take care of these offenders, especially when there's no actual forensic psychiatry ward that's specialized in reducing the recidivism of these offenders. For example, in 2009, one of the offenders who were under custodial protection due to his schizophrenia diagnosis got out of the hospital earlier than expected. He had a lot of disturbing behaviors in the world. Actually, the hospital thought he had some kind of psychopathic personality and could not tolerate him staying in the hospital with other patients. They just wanted to get rid of him as soon as possible, so they convinced the court to shorten his time of protection and discharged him earlier than his original court order. Tragically, he went on to murder another woman after discharge. The government investigation concluded that the process was flawed, but in the end, no change has been made. And it just went on to be the same regulation in the past 15 years. So basically, in Taiwan, when someone shows some troubling behaviors, he may be taken to the hospital first by the police or an ambulance if they think the person needed medical attention immediately. And if he has some criminal behaviors, then he might be put into the criminal justice system, as what we just mentioned. If there are no actual behaviors that caused any harm to anyone yet, then they couldn't be handled with the criminal justice system. That's when the mandatory treatments come into play. In Taiwan, the mandatory treatments are pretty much similar to civil treatments in the US. However, even we try to persuade the government to set up a mental health court to deal with these issues, there's still no such kind of court in Taiwan yet. As a result, the police and the administration usually send the patients to the hospital, even if this might pose a threat to the medical staff, and we just had to process them in the hospitals. So let's briefly introduce the mandatory treatments in Taiwan. Currently, there are two types of mandatory treatments in Taiwan if the patient refuses psychiatric care. One is involuntary hospitalization, and the other is mandatory community treatment. The Mental Health Act in Taiwan was said to be not compatible with the CRPD in the past. The CRPD was adopted by the United Nations in 2006. Basically, it just opposed to any kind of inhumane detention for those people who suffer from mental illness. By 2018, it has been signed by 161 countries, but not all of them ratified the convention, including the United States of America. As a non-member state of the United Nations, Taiwan could not become a state party to the CRPD, But in order to elevate our international participation, in 2014, the legislature of Taiwan passed the CRPD implementation law, providing that the CRPD provisions shall have a domestic legal status. So, in order to follow the spirit of CRPD, Taiwan's Mental Health Act went through a huge amendment in 2008 and established the standards for mandatory hospitalization and community treatment. The newly revised Mental Health Act enhanced the procedural protection for people who are subject to compulsory psychiatric admission. It limits the section to only the severe patients. By definition, the severe patients are those who lack the competence to handle his or her own affairs under the influence of mental illness. That is, they have to present clear thoughts or odd behaviors that are detached from reality and was incapable of managing their own affairs. However, it is unclear in the Act that if the patient was diagnosed to be a severe patient, would it be a permanent identity or just a temporary status? And it also didn't say clearly that to what level someone can be judged as not being able to manage himself. But using this definition means not all psychiatric patients could be subject to this section, and this severe patient definition is more behavior oriented rather than limited to just mental illness. So, if the severe patient meets the criterion of dangerousness to self or others, he or she could be compulsorily admitted to a hospital under the suggestion made by two board-certificate psychiatrists. They have to send all the information to a review committee for their approval. It is not the psychiatrist's decision to make, but the review committee, they have to decide what to do in the end. And that's the biggest change of the Mental Health Act in this amendment. On the other hand, if the severe patient has no such self-harm or dangerousness to others, but they were unstable or incapable of taking care of themselves and refused to receive any psychiatric treatment, one psychiatrist could ask for the review committee's approval for a mandatory community treatment. That means the doctors could administer a long-acting antipsychotic injection to the patient against his will, or add some medication to his meals without him knowing it. However, after the amendment of the Mental Health Act in 2008, the annual number of compulsory psychiatric admission has dropped dramatically from over 3,000 people in 2007 to 1,140 in 2008. In 2008, when the act was amended, and it just kept dropping to 772 in 2013. The number dropped 5 times from 2005 to 2014, which is a lot. However, due to the lack of funding source, you can see the mandatory community treatment only applied to a few cases after the implementation. You can see from this chart that despite the drop of compulsory admissions, actually, the annual number of psychiatric admissions that's covered by Taiwan's national health insurance has been increasing over these years. So the decrease in the ratio of compulsory admissions was greater considering the increasing trend of overall psychiatric admissions. But people might concern that if we didn't put more of these dangerous patients in the institution, would society become a more dangerous place? The answer is not really. In Taiwan, contrary to most people's conception, criminal cases are not on an increasing trend. Fewer crimes were reported to the police even even we reduce the compulsory admissions. This might reflect the fact that criminal behaviors inflicted by mentally ill patients are just a small part of the whole picture. And it is not fair to just focus on these people who are already sick and put more blame on them for the whole society's safety concern. So let's take a step back and see how Taiwan reacted to the violence when it happened to the doctors or nurses and it's not specifically from a patient's behavior. Actually, over these years, all these murder or violence accidents that are covered on the news in Taiwan when it's done by a psychiatry patient, it just caused a lot of discrimination and discussion, but no actual law was changed. But Taiwanese people were so into politics, so that in 2013, when a KMT, that's a Taiwanese party, political party representative, KMT representative just slapped a nurse in the face, the whole thing just blew off. The nurse refused to inform the representative about her father's condition over the telephone. Then she just went to the hospital and slapped the nurse. It was not a murder case, but surely full of political influences. And the legislative authority in Taiwan has never been so efficient and passed the amendment of the Medical Care Act just the next year. In the past, when a doctor was attacked by the patient or the patient's family, they could only try to sue the attackers under Taiwan's criminal code, and usually a doctor is not willing to do so. So the new Medical Care Act says specifically that the police should eliminate or restrain the attacker, and the authority, which is the prosecutor, should investigate automatically. And the penalties for these actions not just limited to the attack on people, but also included those behaviors that caused damages to the equipment in the hospital. This amendment surely reflects the government's attitude on zero tolerance for violence. Even at one point, some people suggested that the offense against doctors or nurses should be considered as severe as an offense against public safety. But this motion was denied because the Ministry of Justice thought it would give the health providers too many privileges. And certainly, people thought the amendment could change the culture that people think they can attack the doctors and still not getting sued, because usually doctors show more mercy on patients. But did it work? From a report, only 33 court cases were found to be convicted between 2014 to 2018 in Taiwan, and while every year over 200 hospital violence were reported to the authority. And after the amendment, the number of hospital violence reported to the ministry did not change annually. So it's really hard to say people actually changed. And the cultural issue still remains because the police also do not want to arrest people when they are called to the hospital. In our hospital, when we called 911 and asked for their help, usually the police just arrived late and they would say they did not see what happened and could not arrest the person who just attacked our staff. Thus, the first-line officers just needed to be educated, and usually when the incidents are more severe, our hospital had to find their superiors in order to ask them to start the investigation. So back to what our government proposed recently about the forensic mental hospital or indefinite custodial protection. Will it work? As we know from what I just briefly described, locking more patients up and longer might not be the core issue if it's the main purpose of these measures. And many scholars in Taiwan are quite concerned that this might be a setback for human rights and our society is not just advanced enough. However, even forensic mental hospital means better and more specialized care for the patients in need. It might not be a bad idea, but our government just said repeatedly that they didn't have enough money to build such a facility, and right now, just recently, they said that maybe it's better to just keep these offenders or patients in general psychiatry wards that are already there, which did not change anything. And I think the key to preventing such violent events from happening in the hospital, it's more practical to set up more physical security measures first, such as metal detectors and more security in the hospital, and give them more power so that they might act as the police in order to protect the health providers. And also, the education to people about how to appreciate the medical staff and understand their own frustration when dealing with their own illness. This may sound a little unrealistic, but I think it's more practical compared to revising the law and raising up the penalty. And most importantly, it's not just focus on the whole violence prevention on mentally ill patients, but to see the community security as a whole issue regardless of its patient or not. So that's just my lecture for today, and thank you all for your attention.